Coming up on Managing Asia, we dive into the world of healthcare and find out how one player, IHH Healthcare, is taking steps to transform patient care. IHH Healthcare, one of Asia's largest healthcare providers, operates a network of hospitals, medical centers, clinics, and ambulatory centers across 10 markets. The company is home to well-known brands such as Acibadem, Mount Elizabeth, Fortis, Pantai, and Gleneagles. Dr. Prem, nice to meet you.
Nice to see you.
At the helm is CEO Dr. Prem Kumar Nair, who is leading the group's expansion and digitalization initiatives. I recently spoke with Dr. Nair at Mount Elizabeth Orchard in Singapore, where IHH is investing 350 million Singapore dollars in a significant refurbishment. The upgrades will include more single rooms, advanced medical equipment, and new technology. Dr. Nair gave me a tour of a newly upgraded suite, now equipped with smart technology. He explained that the group's digital transformations were fast-tracked by the COVID-19 pandemic. So what goes into building up this digital ecosystem, and what does it mean to the patient at the end of the day?
This room is a good example of that. For example, you can see your daily schedule. If you are a maternity patient, you will see some information related to maternity. So one of the other interesting features in this room, right, is to address a very common risk that we have in hospitals now, which is patients falling. So today we have got a sensor up there, and it's smart enough to detect a regular movement, like a patient just sitting up in bed, versus a patient intending to get out of bed. All right, it picks it up, it alerts the nurse at the station, and she can quickly come in and stop the patient from getting out of bed. This also reduces nurses from having to come in and out of the patients' rooms all the time. So this is now being installed across Singapore, even in our hospitals in Malaysia, India. What we are trying to do in Mount Elizabeth is to make it a smart hospital.
IHH is certainly not immune to pressures coming from higher staff costs, rising energy prices. Is it getting much more challenging to rein in these costs, at the same time delivering quality healthcare to patients?
Yes, it is. Healthcare is getting very competitive. That's number one, right? We've got lots of competitors who have either been there and are still growing, or we've got new entrants coming to the healthcare market. That's number one. Secondly, because of payer pressure, we can't increase prices, all right, on a women FNC. We only increase prices to capture inflationary growth. That's all, right? So our financials are pretty much dependent on us being very efficient with costs.
How big a problem is medical inflation? And how much of it can you actually pass on to your customers?
So typically, medical inflation is higher than consumer price inflation, right? Because of the technology we use, the very expensive gadgets, very expensive consumables. So medical inflation is very high. And in one of our countries now, Malaysia, it's become a fairly big issue. You would have read about inflation, medical inflation of 15%, all right, when their CPI is in the region of 4 to 5%, right? So medical inflation is very high. We can't pass on 15% cost to our patients.
How much can you pass on?
We usually pass on 2 to 3%, all right, low single digit, and that's the CPI. That's our annual price increase, which our payers know about, our patients know about, and I think they can stomach that. The rest of it, our margins really have to be preserved or increased purely by controlling costs, right, and becoming more efficient, basically.
Where can you cut costs in this environment?
Well, we can manpower. Healthcare is still very manpower dependent. Nurses, allied health, support staff, we are still very dependent. But we have been doing a lot of nursing process improvements because nurses are some of the most expensive people we have in our system. There's a worldwide shortage, right? So if we can decant some of the nursing work to non-nursing personnel, all right, then we reduce our manpower costs.
On the revenue side, you've identified the growth potential from your diagnostics and laboratories business. What are you doing to scale up your deep clinic expertise and capabilities to become a truly global player in this space?
We have now identified the lab business as something that we can take to the regional or global level. And what does this mean? Laboratory medicine and diagnostics is also moving higher up the technology ladder. Genetic medicine, precision medicine, genomics. These are very high-end tests that require very specialized staff to do it. They are high-margin tests. So what we are doing is to set up regional reference laboratories. So today, from Singapore, a lot of specimens flow to the US for these tests. They go to Mayo Clinic, for example, right? Now we want to bring some of these reference laboratories to the region, right? So that we can do some of these tests as well. So that's the new business that we have identified, and we call it IHH Laboratories.
IHH Healthcare is harnessing the latest technology to enhance patient care. Take, for example, the angiography suite at Mount Elizabeth Orchard Hospital, home to the cutting-edge angio-CT machine, the first of its kind in Southeast Asia. This advanced machine utilizes deep learning technology to deliver high-resolution scans and significantly reduces treatment time. What are you doing to make sure that IHH stays at the forefront of the latest medical technology?
Yeah, so we have a group in procurement together with our medical people who continually evaluate these machines. And by the way, it's not necessary for us always to be the first to buy a machine as well. There must be a need, number one. So it doesn't mean we duplicate these machines everywhere because they're very expensive. We don't want to push the cost of healthcare up unnecessarily.
You recently spent 3.9 billion ringgit to acquire Island Hospital, the second largest private hospital operator in Penang. Is the acquisition all about capturing a bigger slice of the medical tourism market in Malaysia?
The biggest growth for IHH for the next 5 years is going to come from brownfield expansion. That means in most of the countries that we operate in, there is an ability for us to either put in more beds, put in more consultation suites for doctors, and expand the business. Now, Island Hospital fits all our criteria, right? It's a hospital that's in Malaysia, in Penang, which is one of our strongholds. So that's the first thing. Secondly, it's synergistic with Penang because our hospitals there are operating at a very high occupancy. Gleneagles Penang and Pantai Penang have no more beds. We can't expand anymore. So the addition of Island brings additional bed capacity for us. Thirdly, it's a hospital that's doing very well financially. So it's earnings accretive almost right from the start. And finally, the point that you were making, it's very strong in medical tourism. 60% of its patients are fly-in patients, predominantly Indonesians. They come in for care. Island has developed a very, very good system for looking after foreign patients. The processes are fantastic. So some of these things we will apply to some of our other hospitals as well.
You've identified brownfield expansion as a key priority for you to ramp up your operations, and you're closely watching markets like Indonesia and Vietnam. What are you looking to buy? What would you be interested in?
We are very strong in Southeast Asia. We have patients coming in from several countries like Indonesia and Vietnam. So I think we've already gone on record as saying that we will expand. Indonesia is the country we are looking at. Some very exciting changes taking place under the new health minister. So Indonesia, Vietnam, some of our competitors have gone into Vietnam, FE Hospital, American International Hospital. So we are watching these two countries very closely.
Let's talk more about India because in 2019, IHH bought a 30% stake in Fortis, making it the largest shareholder. I understand you plan to increase your stake in Fortis. What's the latest?
Well, we currently own 31+% in Fortis. We've got a MTO pending, right, that will bring us above 50%. That's awaiting, some of the legal sort of
Any resolution in
decisions.
sight?
Well, yeah, in a way, yes. It is now down to just one matter, which is the forensics in the Delhi High Court. Supreme Court has disposed of all the actions that were before it. So we're just waiting for the Delhi High Court decision, which hopefully will come sometime this year, all right? But in the meantime, you will find that that hasn't stopped Fortis from growing. So we control the board, so we control Fortis. Fortis has been acquiring hospitals. Fortis has been disposing of some of the smaller hospitals that were not making money in the south. They are growing. The biggest brownfield expansion in our group is going to take place in India. We are going to add 2,000 beds, all right? So Fortis will continue to grow. But in the meantime, we'll just wait for the outcome of the legal case.
In 2022, you actually divested your 49% stake in Gleneagles Chengdu Hospital. Are you recalibrating your China strategy?
Yes. So we took a hard look to see whether we wanted to stay or whether we should exit. But I feel China is a long game. So we looked at China, we divested those assets that we felt were not going to improve at all, and that was Chengdu. But Shanghai is still the most vibrant city in China. And actually, we are about to open a large medical center, an ambulatory center in Shanghai. So we have confidence that China will stabilize and then grow again.
As Group CEO of IHH Healthcare, you're in charge of 65,000 employees across 10 markets. How would you describe your leadership and your management style?
I grew up in healthcare operations, running hospitals, running clinics. I'm a family physician by training.
Do you miss being a physician? Now
Yes,
you're a
I do.
businessman.
Yes, well, I do miss clinical practice, and I keep my clinical knowledge alive by talking to all the doctors and putting them together with some of my big, well-to-do, well-known patients who want to see them, and then I need to get updates. So that's how my clinical knowledge is still, I would say, decent. But I've been doing this management work for more than 30 years now, right? I think I'm pretty grounded. That's probably the best way to describe me. I interact with a lot of my staff. What I enjoy most is visiting our hospitals in all the countries. Every time I go to India, I go to China, go to Brunei for meetings, usually board meetings. I try and spend at least half a day visiting the facility, meeting the people.
Patients, doctors, who's harder to manage?
Doctors.
How so?
Well, doctors are highly trained, very educated, right? Most of them have got very strong views.
You're talking about egos.
Egos, yeah, but also different specialties. Every specialty has got a need, right? If you're a cardiologist, you need a particular kind of a machine. If you're a urologist, you need a certain kind of machine. If you're a radiation oncologist, you need another kind of machine, right? So everybody wants to work in a hospital where they are supported by all these technologies, right? But we have to prioritize, okay? So I think this is one of the issues that we face, all right? Doctors are also very particular about and I have to be very honest, doctors want to have the best outcomes today, and they feel that in trying to achieve some of these outcomes, the hospital has to be a partner in helping them with some of these things. So we have to deal with a wide group of people. Yeah.
Being in a healthcare business for so many years, Dr. Prem, what are some of your biggest mistakes made, important lessons learned for you?
I would say possibly being over-enthusiastic in expansion sometimes, right? We've done that, not just in IHH, but if I look in general at all healthcare companies, sometimes we, in a bid to outdo competition, sometimes we, over-invest or we overdo, right? I think sometimes it's worthwhile being patient to let our hospitals or our clinics grow to a certain extent before you look at expansion. I think that's the first thing. Secondly, I think it's not a mistake, but it's an observation. Managing people is very important. We are a very big people business. So while we've been talking about doctors and patients, I think looking after our people is very important as well, right? And in some of our countries, I think there's a tendency sometimes in a bid to make the business better, you forget what you're supposed to do for your staff.
And finally, what is your vision as you continue to evolve and transform IHH Healthcare? What's next?
I would like IHH to continue, all right, to be a hospital operator that is safe. Patient safety is very important. Safe for patients, caregivers, family members, providing high quality care with the best possible outcomes that's measurable, all right? And of course, being a for-profit company, right, to make sure that we do all that and yet make decent margins and profits.
Dr. Prem, thank you so much for talking to me.
Thank you.